Hi, Mrs. Bernard. I'm Dr. Snyder. I'm one of the ICU doctors taking care of your son. Warren's condition is very serious. We suspect that he has a condition known as meningitis, which is an infection of the lining of the brain and spinal cord. Now we're going to need to monitor him in the ICU and treat him with the appropriate antibiotics while we wait for the lab results. If it is meningitis, that is contagious, which is why we're having to wear these gowns, masks, and gloves right now. What questions can I answer for you?
Is he going to be okay?
The majority of children that are treated with the appropriate antibiotics do well, and we're going to do everything we can with them while he's in our care.
Dr. Snyder, it looks like Warren's O2 saturation has dropped to 89%.
Oh, thank you, Chelsea. Yes, if we can go ahead and increase the oxygen, and let's go ahead and send for an arterial blood gas.
Okay.
Mrs. Bernard, it does appear that your son is having difficulty breathing on his own. He's not getting the oxygen that he needs, so we're going to need to put down a breathing tube, which is called intubation, to help breathe for him. Chelsea, if you could also call the respiratory therapy when you get a second to help assist us.
Okay, I will. Thank you, doctor.
Hi, Mrs. Bernard. My name's Bruce. I'm with Respiratory Care. And as Dr. Snyder mentioned, we're going to be putting a breathing tube in Warren to help him breathe, and then we're going to place him on this ventilator. It's going to help take out his work of breathing to where he can fight the infection. Do you have any questions about the ventilator?
Will he be in any pain?
We're going to try to, well, we will give him some medication to keep him comfortable throughout the whole process. Dr. Snyder, since he's 70 inches, how do you feel about tidal volume of 500 and a rate of about 14 for the acidosis, and then put them in PRVC?
That sounds good. I'll go ahead and put the orders in.
All right, thank you. Got equal chest rise, bilateral breath sounds, but I do hear some crackles. When would you like to get another ABG?
Let's go ahead and send off for another one now, and then Chelsea, if you could also look to see if we have any other lab results back in.
Okay, I'll go check.
Mrs. Bernard, I did just hear from the lab. It does confirm that your son Warren has Neisseria meningitis. So we're going to be treating him in the ICU on the appropriate antibiotics. And the lab went ahead and notified the public health.